A very good afternoon to you. This is your Thursday edition of the Daytime Update. Now, South Africa recorded over 2,000 COVID-19 infections yesterday. This is the highest recorded number of infections in several weeks. While over 353,000 healthcare workers have been vaccinated, the increasing numbers of infections seem to indicate that the country may face its third wave soon. To help us understand how the country can prepare for the third wave, I'm joined on the line by Dr. Akhtar Hussain, board member of the SA Medical Association. Good to have you with us this afternoon, Dr. Hussain. Perhaps let me start with a question that I really have been asking, and would be really keen to hear what your answer to this is. There's much talk of a third wave. What are the indicators that we are entering or have entered a third wave? What is it that we ought to be looking out for as a nation that will definitively say that this is the status quo, that of a third wave?
Good afternoon, the listeners. Thank you very much for your questions and having me in your program. Yes, definitely we are seeing the sign of a third wave because previous week, as you mentioned, the numbers were 700, 800, maybe 1,500, but yesterday and today the numbers are just doubling up. It's more than 2,200 today. So the issue is, if this is consistently increasing more than 10% or 20%, a number increase doubling up, it means we are in a third wave because the numbers were going down and down. And if it is less than 500, one can say we are declaring the lockdown out of the COVID-19, but it didn't happen. We couldn't declare the COVID-19 lockdown from number is never go less than 500. So the problem is, it's a serious problem. You have seen the third wave is already in India. Many other countries, Malaysia and Japan, many other countries, they got third and fourth wave going on. So we are facing number increasing, and our borders are not closed, flights are not closed, and the different virulence are coming, mutations are coming to South Africa from different countries. And the most important in third wave, the potential driver is behavioral change. If we didn't learn much from our first wave and second wave to change our behavior, because the behavior is like attending parties, attending mass gathering, celebration, wedding, church, mosque is full. So those are the behavioral transmission increase COVID-19, because human to human transmission is the only way is go. And if you look at the pattern, every 2 to 3 months, the virus go down, and after 6 to 8 weeks or after 3 months, the virus go up. So the first wave gone down, then after a few months, the second wave came, and second wave is going down, and now it's starting third wave.
So, Dr. Hussain, you are highlighting some of the patterns that we're starting to see here. You mentioned earlier on as well that the ideal number for the government to at least look like they're having a control over COVID-19 is to have 500 or less cases per day, but we're not reaching that target. Instead, the numbers continue to escalate. In January, you already started speaking out, saying that the government doesn't seem to be prepared, and they're actually less prepared now than they were for the first wave. In your opinion and your expert knowledge, what is it that government ought to be doing to avert this looming third wave?
Yes, the government should have done more vaccination. That was the main answer. If we supposed to vaccinate by now at least 20 million people, but now we only vaccinated 350,000 health workers. We're supposed to vaccinate 1.2 million healthcare workers. Actual rollout of vaccine didn't started. Community or citizens are not getting vaccine. We are still registering above 60 and elderly people, vulnerable people. We haven't started our vaccination. And the more you vaccinate, you delay the third wave coming in the country or in the peak or the searching of COVID-19. The transmission can be delayed by putting the implementation, strict implementation, social distance, mask. We have been talking all this time, sanitizer, hand washing, stop overcrowding. We've been saying ban it, the party, the wedding, the mass gathering. Those are the very basic non-pharmaceutical implementation strictly should be implemented. We did curfew, but we did curfew very relaxed way.
Dr. Hussain, should the government have closed the borders?
Yes, I think it must be a strictly controlled restriction border. Only the emergency staff can come and go, not for the pleasure of visiting this one place to other place. That is not going to help us, because if you look at the Australia, if anybody coming and they get positive, they will be jailed for 5 years. Look at the New Zealand. They don't allow anybody. In fact, Singapore didn't have any COVID-19 patient for a while. But when they opened the flight, people have started coming, and those are the few patients came. Also, in a whole country, they only got 70 or 75 patients positive. They put them full quarantine. So as a South Africa, we need a strict monitoring, strict quarantine, and we've been telling first and second wave, please get maximum number of quarantine place. Empty hotels are lying there, resorts are lying there. We should have just put them there. So by that time now, we should have reduced this transmission, because second and third wave will be so infectious. If one person get infected, whole household, all the 5 or 6 members get infected, and that 6 or 10 member will cause another 30 people infected. So how are we going to isolate? We don't have a field hospital much around. We don't have a mobile. We have 3,600 primary health clinics. This is the time our first and second wave, we should have upgraded those clinics. So in the community, people should have got all the awareness and primary health care about and the knowledge of coronavirus, because still there is a myth going on. People don't believe enough on coronavirus. They say it's just a infection brought by somewhere, and because we are not doing enough campaign of awareness and health education, so we cannot ventilate every.
Dr. Hussain, we're going to have to leave it for that for this afternoon, but thank you very much for your insight and putting forward your concerns as well as possible solutions on how to best deal with the current escalating number of COVID-19 cases in South Africa. Thank you very much, Dr. Hussain. He is a member of the SA Medical Council.